Well, in this video, I'll teach you the anatomy of the larynx, an important structure in the neck, in anterior part of the neck, containing several cartilages, muscles, and ligaments. The larynx consists of 9 cartilages. Here you see the larynx from its anterior aspect, and here is its posterior aspect. This cartilage is the thyroid cartilage. Here is the cricoid. Here is epiglottis from anterior aspect. In the posterior aspect, you can see the posterior surface of the thyroid. Here is the thyroid cartilage. Here is the cricoid, and here is the epiglottis. In addition, we've got another cartilages in the larynx, including the arytenoids. There are 2 arytenoid cartilages. The arytenoid means pyramid, because this cartilage is pyramid shaped. Yeah, here is the arytenoid. Corniculate. Here is a corniculate. Here is a corniculate. And the cuneiform. Here is the cuneiform, and as you see, it's the smallest cartilage in the larynx, whereas the thyroid is the largest cartilage. Okay, let's study one by one, and first let's study the thyroid, the largest cartilage. Here is the thyroid. This cartilage has 2 lamina. Here is the right lamina, and here is the left lamina. Its lamina join together in midline to form the thyroid angle. Here is the thyroid angle. It's palpable as a prominent in anterior part of the neck, and is also visible in some people, in particular in extension position of the neck, and is called Adam's apple. On the lateral surface of each lamina, we've got a ridge, this ridge, called the oblique line. Oblique line. Here is the oblique line. It's a site for attachment some muscles. For example, this muscle between the sternum and the thyroid is called the sternothyroid muscle, attaches to this line, to the oblique line. Or this muscle between thyroid and hyoid, here is the hyoid bone above the larynx, and this muscle between them is the thyrohyoid. Like sternothyroid, the thyrohyoid is attached to the oblique line. Posterior to the oblique line, we've got 2 horns, a superior horn and an inferior horn. Here is the inferior horn, here is the superior horn, and as you see, the inferior horn is shorter than the superior one and articulates with the cricoid. The joint between thyroid and cricoid is called cricothyroid joint. Here is the right cricothyroid joint, and here is the left cricothyroid joint. And between the cricoid and thyroid, we've got a membrane or ligament called cricothyroid ligament or membrane. So remember that we've got cricothyroid joints, and also we've got cricothyroid ligament or membrane. Look at here. Here is the epiglottis. Yeah, as you see, its lower part is narrow and is considered as its stalk. Here is the stalk of the epiglottis, and as you see, attaches to the posterior surface of the thyroid angle by a ligament. This ligament between the thyroid and epiglottis is called the thyroepiglottic ligament. Thyroepiglottic ligament. This ligament. And this membrane between the thyroid and the hyoid bone is called the thyrohyoid membrane. Thyrohyoid membrane. And here you can see a foramen on either side of the membrane. This foramen is for passing some branches from nerve and vessels. This nerve is internal branch of the superior laryngeal nerve, originated from the vagus nerve. And here is the superior laryngeal artery. So remember that this foramen on the membrane, on the thyrohyoid membrane, is for passing for superior laryngeal. The next cartilage is the cricoid. As you see, it's the most inferior or the lowest cartilage in the larynx, located just above the trachea. And here between them we've got the cricotracheal ligament. Here is the cricotracheal ligament. And above the cricoid we've got the cricothyroid ligament between the cricoid and thyroid. Cricothyroid, cricotracheal. This cartilage has a ring anteriorly and a lamina posteriorly. And as you see, the cricoid lamina articulates with the inferior horns of the thyroid to form the cricothyroid joints. In addition, the cricoid lamina articulates with the arytenoid cartilages. So remember that the arytenoids are located just on the cricoid lamina. Okay, the next cartilage is epiglottis. Here is the epiglottis situated just behind the tongue. Here is the tongue, or glus. Glus is another name for tongue. And here is the epiglottis. And this space between the tongue and epiglottis is called vallecula epiglottic. Vallecula means valley. Here is the tongue, or glus, and here is epiglottic or epiglottis. There are 3 folds between them and called glossoepiglottic folds. Here are the lateral glossoepiglottic folds, and here is the median glossoepiglottic fold. Here you can see a ligament between the hyoid and epiglottis called hyoepiglottic ligament. Here is the hyoepiglottic ligament, this ligament. The next cartilage is arytenoid. Here is the arytenoid, and here is the right arytenoid, left arytenoid, right arytenoid. As you see, each arytenoid articulates inferiorly by the cricoid and superiorly by the corniculate. Each arytenoid contains 2 processes, an anterior process and a lateral process. Here is the lateral process, and here is the anterior process. As you see, the anterior process gives attachment to the vocal ligaments, and because of that it's called vocal process. Anterior process is also called vocal process, and the lateral process is attachment for several muscles. For example, the posterior cricoarytenoid muscles, and is called muscular process. The lateral process is also called muscular process, and the anterior process of the arytenoid is also called vocal process. Both corniculate and cuneiform are situated in depth of this fold called aryepiglottic fold. Here is the aryepiglottic fold, the left aryepiglottic and the right aryepiglottic. These folds extend between the apex of the arytenoid and lateral border of the epiglottis, and are called aryepiglottic. Ary from arytenoid, and here you can see two prominents under the fold. This one, the inferior prominence, is related to corniculate, and the superior one is related to cuneiform cartilages. Okay, so remember that these cartilages, that the corniculate and cuneiform, are located under the aryepiglottic fold.